Our health data contains the most personal and sensitive information about us. It also contains information that is critical for researchers and health planners. Therefore, we must protect our health data while ensuring that it can be used for public benefit. But can we trust that our data will be used well, used wisely, and used safely and responsibly? Transform Health is calling on governments to establish clear rules around the way health data is collected, managed, used, stored, and disposed of. We need a common set of standards on health data governance to ensure people are equally protected everywhere and that health planners and researchers are able to use health data for public benefit purposes. This will also make it easier for governments and others to share information across borders as we travel and move countries and need access to our data, or in health emergencies for countries to share and compare vital information to make informed decisions. Transform Health is calling on governments to support a global framework and champion the model law on health data governance as a basis of a global framework for adoption into national law and endorsement by governments through the World Health Assembly and relevant regional mechanisms. In January 2023, a number of organizations concerned by these issues joined Transform Health's My Data, Our Health campaign to raise awareness of the importance of health data and to call on politicians to ensure clear laws and regulations are in place to protect it, while also enabling others to use it for collective good. Over the last year, they've been engaging the media on this issue. Even parliamentarians are increasingly recognizing the importance of effective legislation and regulation on health data.
You go to Kolebu, Kolebu has its own data. We go to other health institutions, 37 military hospital, they have their own health data. And so when it comes to making national policies, we'll have to find another way of retrieving information from all over to be able to get a central position in for decision making. And so I feel that the subject on health data governance is very important.
People were also invited to take part in the Where's My Data campaign action and to visit their health centers to request access to their data. Over 50% of participants were denied their data. Here are some of the reasons that were given.
My health record is erased due to some technical problems.
He told me to come with a written document or I go to court. Didn't know it was going to be this hard. I thought it was my right, but that's not the case.
In the hospital, there were too many referrals and later denied me my health data records since I might sue them and later on they demanded for a document from Ministry of Health.
Of those who received their health data, over 33% said that the health providers were initially unsure how to respond to the request or asked people to return at a later date. 13.5% of respondents were asked to pay a fee to access their own data. And over 45% of people who received their health data found it to be incomplete. This is impacting trust in the health system. Nearly 50% of respondents were concerned about how well protected their health data is as a result of their experience. People are starting to reconsider the importance of their health data and realizing that we need to pay far more attention to who has it and how it is being used.
Well, for me, in the age of AI, I'm beginning to see that data is as important as safeguarding persons. It's as important as safeguarding a physical being because your data is you.
Good health data governance matters. We encourage you to join the campaign and take part in the Where's My Data action. Make sure we have stronger governance and regulation of our personal health data.